Hi everyone, I hope you guys are keeping well. In this video, I'm gonna share with you 4 important mistakes that people do with chronic lower back pain. By understanding these 4 important mistakes, you can actually recover quicker. If you're suffering from lower back pain, disc bulges, or chronic lower back, non-specific lower back pain, this video is for you. Make sure to watch the video until the end and follow these steps one by one. The first mistake that I see commonly with many of my patients with chronic lower back pain is that they do not have clarity about their MRI report after getting the MRI report done. This is one of the issues that you can see basically commonly with many of my patients. They basically get injured and after a while they've been referred to get an MRI report, and unfortunately after doing that, their orthopedic or person that they basically explained to them what is on MRI, they didn't really clear a clarity for them what does those terms means, and they got kind of panic and they're not doing much about their back, and they've been advised in many cases to take it easy and rest. This is one of the very important things that you need to get from your MRI report after you're doing it. In reality, I do not send my patient to get MRI report because it shows very little information, and in many cases it doesn't necessarily link to their back. But when you do get your MRI report, make sure to ask or help from a professional, like somebody like a physical therapist or physiotherapist that can read that MRI report and explain to you those terms. The second common mistake that I see with my chronic lower back patient is that they do not follow a plan. Unfortunately, due to the way that they get the MRI done, they get some sort of rehab plan to do initially for a very short term, and then after a while they just forget about exercise or they give up, they don't see that much results and they don't do them anymore. One of the most important things that you must follow when you're suffering from chronic lower back pain is to follow a structure and plan in a daily and weekly basis. This plan should challenge you and plus measure your progress in a visual way that you can actually see them. In addition, that plan should give you a coping mechanism that you are able to cope if you hit a setback or basically got sore, what you need to do about it, and you should have a clear idea about it. If you need any help about getting that structure, you can always book an online consultation with me and I will be giving you a detailed plan to follow. The third common mistake that I see with my chronic lower back patient is overprotection. What is overprotection means? Which means they try to overprotect their back with any type of movements that they do. If they want to basically tie their shoelaces or bend and pick up a pen from the ground, they try to brace and overprotect their back. This can be a big problem in the long run and stop you from actually full recovery. They're trying to really overprotect their back and try to really stabilize those basically core muscle with minimum movement that they do. If you do not follow a right plan and not getting a right coaching in your recovery, unfortunately, the overprotection can stop you from full recovery. This can actually make you more sensitive with any type of movement that you do, and based on your history of injury that you have had over years and months, your body become more protective and create more pain with minimal movement. In my clinic, I help my patient with lower back pain to understand graded exposure, which is basically helping you to understand what is your limit and gradually build on that level and challenge yourself and create better beliefs about your body and your back. Just remember this, lower back pain, especially chronic lower back pain, is not totally all related to tissue damage. Is a mental game at the same time, which means you need to regain your basically body confidence to use your body and challenge your body and your back. If you need any further assistance, make sure to leave me a comment underneath of this basically video and I will be more than happy to help. The last but not the least common mistake that I see with my chronic lower back patient is that they are overwhelmed with information. What is information can do to you? It can cause so much problem physically and mentally. Information that you basically see in websites or basically different medical websites and YouTube or anywhere that you search, in many cases are general information that you see and people trying to basically put on some sort of blogs and create some sort of awareness for people with those similar injuries. If you're suffering from disc bulges or herniated disc, you might simply search in Google and look at what are the symptoms, what are the treatment options, do I need surgery, etc. If you've got your MRI report, you might even search those terms in your MRI report, which can create more problem and give you more information. Unfortunately, this is really difficult for me to basically change after seeing people searching so many times in internet and YouTube and basically getting too much information, and they come to me with so much confusion and they don't know actually what they need to do. Please avoid searching too much on internet or Google and try to get help from somebody who is actually understand chronic lower back pain, disc bulges and herniated disc. And I would definitely suggest you to see a physical or physiotherapist. Why? Because our job is meant to help people to improve their pain and get them mobile and help you to give you some sort of daily activity to get back to your routine. We're not trying to push you with pills or painkillers or injection or surgery. This is so important for you to understand that 99% of low back pain or disc bulges or herniated disc does not need surgery. Thank you for watching this video, guys. I hope you guys find this information helpful. And if you're suffering from disc bulges or herniated disc, you can always leave me comments and I would be more than happy to help you. If you need further assistance and if you would like to get a very clear understanding about your MRI report or have a plan to follow for your recovery, I'll leave a link below that you can book an online consultation with me that I would be more than happy to help you to get a structure to your plan and gradually build up that plan and build up strength physically and mentally and go back to your daily activity even stronger. I do help many patients all around the world online and give them a plan to follow step by step, gradually build up their physical and mental confidence. Make sure to check out that link, and if you have any question, make sure to leave me comments. Don't forget to subscribe my channel for my weekly update, and don't forget to press that like button. Until next week, all the best.